This is Dr. Kelly-Dokubo, and I became a cardiologist because I was always very fascinated with the heart. The heart is a multifaceted organ with several components of its function. There is the electrical, there is the muscular, there is the vascular, and even a hormonal aspect to the heart. So there's a wide spectrum of areas that could provide the budding or aspiring cardiologist to be involved in. Challenges in embarking on a career in cardiology for me were primarily financial, being an immigrant into this wonderful country. But I was very fortunate to have individuals in my life who were philanthropists and supportive, and subsequently enabled me to complete my professional career and endeavors. Some of the personal challenges that I encountered, of course, as a minority, were some of the racial attitudes that one might experience as one goes through this journey. I remember vividly being assigned to a counselor who tried to discourage me from embarking on a career in medicine. This was rather very disappointing, but nevertheless was a trigger that motivated me to prove this individual wrong. Diversity is obviously very, very important in the field of medicine and cardiology. We encounter patients from different ethnic and cultural backgrounds, and to have a professional community that also satisfies this um, spectrum of and variations of patients' cultural backgrounds could be very, very beneficial for the parents and for the patients. There are several ethnic nuances that might be alien to certain physicians with different cultural background, and makes it much easier for communication between the patient and the physician, being able to understand that way of expression if a patient presents with an illness that they're not able to communicate effectively to somebody of a different cultural or ethnic background. I'm very pleased to find that the ACC is promoting and emphasizing the need for diversity in our specialty. This would obviously increase the reach into the community at large, and make it easier for patients to receive the type of specialty care that we provide. I am particularly interested and very encouraged also to know that the ACC is reaching out to our high school students. These are young minds that need to have the exposure that there is an opportunity for them with a professional career in cardiology. High school students can also be advised and encouraged to call up hospitals and inquire as to the staff cardiologist and request an audience. And such one-on-one interactions would also provide an opportunity for any of their personal questions or curiosities to be answered. My advice to students is not to lose their eye on the prize, and to always keep their eye on the prize, and to know that this is a very fulfilling career, and would provide an experience whereby they can impact the lives of patients, and actually be able to implement immediate changes in the lives of sick people who present to the emergency room. And one thing that I've always found captivating is to see a patient who presents to the emergency room in dire and precarious conditions, and within hours looking so different and lively. this is such a very rewarding experience that I can never have enough of. And we're hoping that this mission would come to fruition as we extend our influence in the community and world at large.